is Dr. Marty Rein. I'm the clinical director at Aspen Ridge Recovery Fort Collins. I have 3 degrees, PhD and MED, and a Bachelor of Music. The music is music education, which was one of my first careers. The MED in counseling I got in 2007, and the doctorate was 2011. Being a musician who's in recovery, training to be a therapist, it seemed like a perfect fit, and so I was asked and have been doing a musicians recovery group here in Fort Collins since 2010, every week for the last 9 years now, apparently. In the meantime, I was working on my private practice and had that going for about 3 years successfully, and a position came open as a CDIOP, a chemical dependence intensive outpatient program coordinator. I worked at that program for about 3.5 years, and that's when this position came open here at Aspen Ridge. And it was a very enticing opportunity to work at a company that really had their clients' best interests at heart from the ground level. And so that was something that I was very excited about, to really start working on a program and build a program, especially in my hometown. When a person gets to that place in treatment where they've actually crossed over that bridge to decide, okay, I'm going to give this a shot, they tend to ask questions like, well, did I get depressed because I drank or used, or did I use or drink because I was depressed? And my answer to that is, by the time they get to a treatment situation, that question in itself is a fairly moot point, that both of those disorders have to be treated simultaneously at the same time. So what I always encourage people to do is, the first thing we know that the antidepressant meds and alcohol or other drugs sort of counteract each other. They sort of cancel each other out. So one of the first orders of business is to get somebody clean and sober long enough so that we can find out what their current medications are doing. And that's something that's very difficult for somebody who's struggling with depression and or anxiety, and they're drinking or using at the same time. For them to have a long enough stretch of sobriety to find out what their real baseline is for that co-occurring disorder takes quite a bit of work. And so that's one of the things that I like about the program here, is that our PHP, because it's stretched out over 90 days, it gives us a good amount of time for somebody to cycle through, first of all, the detox process, and then also kind of find out what the baseline of functioning is of that person after 30 to 40 days, so that we can really do a true assessment on what this mental health struggle might be. When somebody comes to Aspen Ridge Fort Collins, there's kind of a range of modalities that we work with, and most of them are the evidence-based or cognitive behavioral lines. So a lot of CBT, a lot of DBT, so cognitive behavior therapy, dialectical behavior therapy, which is a combination of mindfulness and CBT. And we really try to sort of individualize the treatment. So every person that comes here has an individual therapist and has at least one individual therapy session per week, so that that person can really spend some quality time away from the peer group and really focus in on some of the finer things that are going on in a person. For example, a lot of people have experienced trauma in their childhood, and then that shows up in sort of a borderline personality trait, or again, a trauma might show up as a hypervigilant sort of personality style. With a support system, especially their familial support system, that is already kind of speaking the language and has an idea of what it's like to do that self-reflection, because that's actually encouraging. So a lot of times I will ask a family member, what would you say if your loved one was taking care of themselves, if you knew they were taking care of themselves? And the family member typically says, I'd feel great. And then I ask the addict, what would you say if you knew that your mom or your dad, your husband, your wife, or whoever, what would you say if you knew they were taking care of themselves? And the addict says, oh my God, I would be so happy. I'd feel so supported by that. And so this idea of this co-recovery to me is it's definitely a passion of mine, because I believe it's one of the best ways that we can help people have a better chance at sustained recovery.